Benefits of seeing a chiropractor. Well, I'm a Perth chiropractor and a London chiropractor, registered in both countries, and my experience in helping people that need chiropractic is that they haven't got a great understanding when they first come in of what we do. Often people ask us what the difference between a physio and a chiropractor and osteopath is, and it's quite hard to define, but basically all of us help people with problems in the spine and then maybe the extremities, more so physios. Chiropractors though, if we talk about that, we studied the spine for 5 years, and it's a very important joint or area of the body. All the joints in the body and in the spine work together like a bicycle chain. So unless we actually work in sync, then there'll be problems. So we look for these problems. So on the back of the spine we have these little jutting out bones, they're called the spinous processes, and we'll go through a patient when we lie them on their front and we'll ask if they have any tenderness as we press on them. Usually tenderness is linked with pain. So if you come back over, we've got these pelvis either side, so the iliac joints, and the bottom muscles, so the glute muscles, attach on here and they can get quite tight. They're one of the most important areas to loosen up and stretch, and one of the most important areas to get in and trigger point, and often they can pull on the low back. So if we look over on the spine here, we also look at posture. So we'll get someone to stand up and we'll look at their iliac crests, we'll look at their shoulder levels, mastoid processes, so base of the skull, and we'll ask them to walk, and we'll check all their general ranges of motion out. When it comes to it, if someone's a candidate for the chiropractic care, fast tracking everything, when it comes down to it, the nuts and bolts of chiropractic is that we do an adjustment. An adjustment means we move the joint a little bit, we use a specific contact, we use a high velocity, so a fast, low amplitude, small depth thrust, and it cavitates, creating a pop, and that gas that escapes creates this pop, and it frees up the joint, increases the range of motion, releases the muscle spasm, and it allows these nerves, these yellow nerves, to exit and innervate the muscles and the other structures properly, and reduces the interference. So, in a nutshell, when you come to see a chiropractor, they will do an adjustment as long as you're okay with the history and evaluation and everything else. And it's recommended if you have any kind of muscle, back pain or neck pain, you can either go to your doctor, you go to a chiropractor, and hopefully your chiropractor will be able to assess, diagnose and treat and help you, just like I have with my many patients in the UK and Australia.